Welcome everyone to the second part of the video series on the anatomy of the upper limb. In this video, we will talk about the joints of the upper limb. First of all, we should give a general overview of the joints. On one hand, to make learning easier, and on the other, so we can see the framework we will follow when describing a joint. First of all, a joint generally, in fact in the vast majority of cases, has a name. Secondly, we must always specify the articulating bone surfaces. And from the bone surfaces, or rather from the constituent bones, we usually get the name of the joint. But this is not always the case. There are instances, for example with the elbow joint or the ball joint, when the joint does not get its name from the articulating bone surfaces or the bones, but instead receives a completely different name. After this, it is worth specifying the type of the joint, and from this we can already infer what kinds of movements the given joint is capable of. We can also talk about the joint capsule and the ligaments of the joint. These are the so-called obligatory components, meaning there must be a bone forming the joint, there must be ends that can articulate with each other, there must be a capsule that covers the joint beneath, and there must be ligaments. These are the obligatory components, so they must be present in every joint. However, there are certain special components that may be present in a given joint, but their presence is not mandatory. A joint is still considered a joint even if these special components are not present. For example, there are joints where the articular surfaces do not match each other, which is called articular incongruence. In such cases, special components are needed, which we will see, that compensate for this articular incongruence. These are called discs and menisci, for example. Before we describe all the joints of the upper limb in detail, it is worth reviewing which ones we will be discussing. The most proximally located joint related to the bones of the free upper limb is the articulatio sternoclavicularis. So, among the shoulder girdle joints, this is the one situated more medially. As its name suggests, it is formed between the sternum and the sternal end of the clavicle. The other shoulder girdle joint, which is located more laterally, is at the acromial end of the clavicle, and is formed between the acromion of the scapula and the acromial end of the clavicle. This is called the articulatio acromioclavicularis. Among the joints of the free upper limb, the most proximally located is the articulatio humeri. As you can see, this is formed between the appropriate part of the scapula and the head of the humerus. Here we can also see an example of how a joint is not necessarily named after the bones that articulate, so for instance, this is not called the scapula. However, in some places it is also commonly referred to as the glenohumeral joint. The more distally located joint is clearly formed between the distal end of the humerus and the two forearm bones. This is the articulatio cubiti. As we will see later, the hand is a rather complex area, both in terms of joints, muscles, and neurovascular supply. For this reason, it is worth approaching the hand because there are numerous and intricate joints in this particular anatomical area. The most proximally located and significant joint is indeed the articulatio radiocarpalis, or, to elaborate further, the articulatio radiocarpalis can be precisely seen as being formed between the distal or lower end of the radius bone and the entire proximal row of carpal bones. As was thoroughly mentioned in the previous video, the carpal bones inherently have a distinct proximal row and a separate distal row. Between these two crucial rows, there is a very important joint, which facilitates movement and flexibility, which in terms of its movements is rather negligible, but at present we call this the articulatio intercarpalis. There are also joints located between the distal row of carpal bones and the bases of the metacarpal bones, which are collectively called the articulationes carpometacarpalis. Following this, the joints marked with a red star are those situated between the heads of the metacarpal bones and the bases of the proximal phalanges. These are formed between the bases. These are called articulationes metacarpophalangeae. And here, the joints that are formed between the phalanges are marked with blue stars. These are called articulationes interphalangeae. Among these, there are visibly proximal and distal interphalangeal joint rows, with the exception of the pollex, because, as we saw, the pollex does not have a middle phalanx, so there is only a single articulatio interphalangealis there. The first joint we will discuss is the articulatio sternoclavicularis, which is the more medially located of the shoulder girdle joints. As its name suggests, articulatio sternoclavicularis, we can deduce which two bones it is formed between. These are the sternum and the clavicle. When discussing joints, it is important to specify exactly which part of the given bone contributes to the formation of the joint. In the case of the sternum, we can talk about an area called the manubrium sterni, and on this manubrium sterni there is a notch, an incisure, that corresponds to the clavicle, and this is called the incisura clavicularis. So, on one hand, it is the incisura clavicularis of the sternum that contributes to the formation of the joint. On the other hand, the clavicle also has a corresponding area that helps form the articulatio sternoclavicularis. As we have already seen, this joint is located at the sternal end of the clavicle, the articular surface, the fascies articularis sternalis, which also contributes to the formation of the joint. Now, at first glance, it is apparent that these articular surfaces do not match each other. In this case, we call this articular incongruence. This can be observed between the articular head and the articular socket. Nature, or evolution, has solved this by placing an articular disc here. An articular disc which we call the discus articularis. The definition of the discus articularis is that it completely divides the joint cavity into two. In this case, we can talk about a so-called disco sternalis, meaning the joint part located between the disc and the sternum, and the disco clavicularis, meaning the joint found between the disc and the clavicle. But there are cases when the disc does not perfectly separate the joint cavity into two. In this case, we refer to it as a meniscus, which will come up later when discussing the knee joint. So, from this perspective, this area is special. From another perspective, this area is interesting because we see that in most cases, the articular surfaces are covered by hyaline cartilage. In this case, however, we are not talking about hyaline cartilage, that is, not glassy cartilage, but rather what is called fibrocartilage, as this suits its function. What we can also look at here are the ligaments. Among the ligaments, you need to know a total of 3 types. There is one ligament that is not shown here, but you can imagine that it is located roughly in this area where the other clavicle is, and it connects the 2 clavicles on either side. This is called the ligamentum interclaviculare, as it is found between the 2 clavicles. There are also ligaments located between the sternum and the clavicle, and these are present both at the front and at the back. These are called the ligamentum sternoclaviculare anterius and the ligamentum sternoclaviculare posterius, since they are also found at the back. And there is another ligament that we already saw in the previous video. It stretches between the depression on the inferior surface of the medial end of the clavicle and the upper surface of the first rib, and this is called the ligamentum costoclaviculare. This ligamentum costoclaviculare essentially is the main factor that restricts the elevation of the clavicle. So these are basically ligaments that serve a restricting function. Before we look at the movements, it's worth discussing what type of joint we're dealing with here. Now, the sternoclavicular joint is what's called a constrained synovial joint. The fact that it's a constrained synovial joint doesn't actually mean much because a synovial joint means that it can perform movements in any of the 3 spatial directions. The term constrained means that while it can perform those movements in all 3 spatial planes or directions that we can readily imagine and perceive, but in a significantly more restricted and constrained manner. In this case, these primary limiting factors are predominantly the strong and fibrous ligaments surrounding the joint. But what specific types of movements and ranges of motion are we truly capable of performing within the confines of this particular joint? On one hand, we can elevate the clavicle upwards within the confines of this joint and conversely depress or lower it downwards. When we actively raise the clavicle, moving it superiorly, as you can personally attempt and experience for yourself, this particular action is formally termed elevation. When we deliberately lower it, we refer to this particular movement as depression. So this specific action is known as depression. The clavicle, which is also commonly known as the collarbone, can also be moved quite easily in both a forward and a backward direction. When we carefully move the clavicle forward, this distinct movement is precisely called protraction or alternatively protrusion. So to be clear, this is either protraction or protrusion. When we gently pull it backward, we accurately call this action retraction, or more formally, retrusion. Additionally, the clavicle, this important bone, along its longitudinal axis, so in a manner that is approximately like this along this particular axis, we are additionally capable of rotating the clavicle, and this specific action is precisely what we commonly refer to as rotation. And when we specifically desire to execute these particular movements, so the precise and sequential execution of elevation, which is an upward movement, depression, a downward movement, protraction, a forward movement, retraction, a backward movement, and rotation, a turning movement, then in such instances we formally refer to this comprehensive action as circumduction. This is a complex multiplanar motion. So let's discuss circumduction. In the specific case of circumduction, what precisely happens is that we actively move the lateral outermost end of the clavicle along a distinct, continuous circular path. Therefore, we deliberately move it along a complete circle when we perform these 5 distinct types of movements at the sternoclavicular articulation, which is a crucial joint.